Hello, everybody. Hi, this is Dr. Ken Muich, the Fibromyalgia Wellness Center, and here today to talk about the differences, if there are, and also similarities between chronic fatigue syndrome and also fibromyalgia. Chronic fatigue, also known as chronic fatigue syndrome or CFS, chronic fatigue and immune dysfunction syndrome, CFIDS, also myalgic encephalomyelitis ME. Sometimes you'll find it and see it as CFS/ME. The definition of hello, Shelley, how you doing? Anybody wants to question, answer anything, send out any information, please feel free to while I do the presentation, and we'll get to them as soon as we can. Thank you for the thank yous. Had a nice following. A lot of people do, I think, follow this. Some follow by sending questions, and other ones just want to listen to what I have to say. Hopefully it add more knowledge to what may be a real problem. Hey, listen, I'm going to stop here and just explain something. I've been working with fibromyalgia patients since 1990. And no, as I mentioned to people before, there's no fibromyalgia patient that just has fibromyalgia. Everybody has additional symptoms. They could be chronic fatigue. They could be osteoarthritis. They could be hypoglycemia, hypothyroidism, lupus. It could be rheumatoid arthritis. It could be a vast majority of different conditions and so forth that fibromyalgia patients have, and that makes it obviously more complex for doctors to differentiate. But out of all of these conditions, all of these symptoms, the most common, and I hate to use words all, every, and never, but almost all fibromyalgia patients have some form of chronic fatigue. We usually call it, I'm going to talk to you about this and a few other things, the mental disturbance that patients have, the tiredness, the fatigue, and so forth. The fibromyalgia or fibro fog is very, very common. Now, not all chronic fatigue patients have fibromyalgia. And that is 100% correct. But the vast majority, in my almost 30 plus years working with fibromyalgia patients, have some form of chronic fatigue. Now, the definitions that they use is symptoms associated with unrelenting and debilitating fatigue. Now, there's a lot of similarities between chronic fatigue and fibromyalgia. That's why sometimes it really gets kind of mixed up. The most common ones, obviously, are fatigue, loss of concentration, and that's what I was trying to get at, and we usually call it, for fibromyalgia patients, fibro fog, muscle and joint pain, headache, sleep deprivation, GI problems. So all of these are very, very similar with chronic fatigue. The differences are that for chronic fatigue patients, the symptoms wax and wane. They come and go. They have a tendency to get less, and then all of a sudden they come back. Also, there are no 11 out of 18 specific points of pain. If anything, chronic fatigue patients have a higher level of resistance to pain, so to speak. Push at them a lot harder to actually get a response. And also with fibromyalgia, I mentioned to you, we do mapping where we check because of the excess chemicals within cells, the calcium and phosphate, they build nodules and fluid-filled areas and so forth under the skin. There are no such things on chronic fatigue patients. There are no swellings or nodules and so forth. In 1994, the Center for Disease Control set certain guidelines for chronic fatigue patients. And there has to be a severity level, they said. And the severity can either persist or it can come and go, relapses, and it's unexplained fatigue. Just like fibromyalgia, all of a sudden there's a severe amount of fatigue and inability to function. There's no identifiable onset that they can really relate to, but we're going to get to that in a few moments and explain there might very well be. No alleviation of any symptoms by rest. Now, they also said that there have to be 4 coexisting symptoms along with this fatigue, and they include the following. Cervical or axillary. Now, cervical is the neck. Axillary is like in here, this area here. Axillary lymph nodes or nodules that are swollen. And this goes along with the sore throat. This is very, very common for chronic fatigue patients. Also, there's joint and muscle pain, and that's quite common again. That relates to fibromyalgia, so you can understand where this comes from. Also, a new type of headache. You may have had headaches before. Now, they may be different. They may be located in a different location, and the severity is much greater. Also, they call it post-exertional malaise, and I find that difficult to differentiate between that and fatigue. If you got fatigue, you got fatigue. If you're active, it makes it worse. Again, this is what happens to fibromyalgia patients, but still the same thing. So you have this post-exertional malaise that lasts over 24 hours. Now, there's other things that must recur over at least a 6-month or more consecutive months. These must persist. And all of these things must be in existence for, like I say, at least a 6-month period or longer. And they can have any mix of those. But for fibromyalgia patients, I find most of them have this fatigue factor. And most other common would be the sore throat with lymph node swelling. Now, fibromyalgia and chronic fatigue syndrome do coexist in many respects. Fibromyalgia chronic fatigue patients have food allergies. They have chemical sensitivities such as gluten intolerance. They have IBS or GI problems, and it's common in both sexes. Now, chronic fatigue patients, studies have found that more females than are males. However, that's because there are more females that go to doctors to get diagnosed again than are males. Males, again, have that ego thing, and they try to work through things. It's also similar as far as teenagers and young adults and so forth. It's not uncommon for them to have chronic fatigue also. So it affects all ages and all sexes. Now, in our studies, and with Dr. Sainaman, with his studies through UCLA research, has found that there are some similarities as far as predisposition. Such as toxicity within the system, physical, emotional, chemical reactions that occur that often trigger the chronic fatigue at a much higher level. And these are commonly seen in chronic fatigue and fibromyalgia patients. And again, that makes it much more complex. When we work with fibromyalgia patients and we have them diagnosed with chronic fatigue, believe it or not, we place them on a very similar protocol. We put them through the detox period, and we also place them on the guaifenesin. And this really seems to help the chronic fatigue patients. Most times, most symptoms are gone except for the fatigue factor. I've got one patient that has gone from almost non-functional to fully functional, but he still has that waxing and waning of fatigue. It comes and goes every once in a while. And so that's not the fibromyalgia aspect. That is the separate condition of chronic fatigue itself. So how can you help yourself if you have either one or both of these? Well, as I mentioned before, if you're on medications, make sure you check the pharmaceutical labels and check and find out what the side effects are. If the side effects include, muscle soreness and aches, or irritable bowel, or something like this that you already have symptoms of, you may wish to go to your doctor and you may say, do you have something that doesn't have these same side effects? Remember, as I mentioned in the last talk I had through the FDA and manufacturers of pharmaceuticals and OTCs, over-the-counter drugs, accept the fact that all of these have side effects, whether it be pharmaceuticals or pharmaceuticals that are over-the-counter. They all have side effects, and you have to be cognizant of what they are, and also understand that, like the FDA says, that the benefits have to be greater than the risks. So if your headaches are extremely bad, and one of the things on there, it says headaches, I would strongly suggest you find another pharmaceutical or OTC. That's the number one thing that you can help yourself with. Other things that we found that really help chronic fatigue patients, because we have chronic fatigue patients, as I said, without fibromyalgia. We put them on the protocol, including the guaifenesin, but we take them off of, again, sugar, trans fatty acids, we take them off of dairy, we take them off of gluten, we take them off of alcohol, we take them off of caffeine, we take them off of carbonated drinks, we take them off of all of that, and they do improve appreciably. I can't say enough about the fact that our protocol works on the condition aspect, and if you work on conditions, you get better, and you stay better, and you stay healthier, and you function at a much higher level, rather than missing a pill or something from pharmaceuticals or some other avenue of treatment, and then you have a tendency to have these symptoms come and go. Again, chronic fatigue, you will have these. You'll have these periods where you feel pretty good, but it will come back. Hopefully with our program, and we've seen it in the past, the symptoms do not come back in such a high level. The headaches are a lot less, the fatigue is a lot less, the muscles, aches, and pains usually go and disappear. So we know that our protocol works quite well. Look, if you have any questions, okay, on any of these things, feel free to send me a message. My email is dcken2000 at C as in cat, S as in Sam.com. That's D as in dog, C as in cat, Ken, K-E-N, the number 2000, at C as in cat, S as in Sam.com. And I'll try to get back to you as quick as I can. Some of the people send them right through the Fibro Wellness Center. Because I get so many of them, I may not be able to get back to you within 24 hours, but I'll get back as soon as I can. And usually the answer is not just yes or no. I spend time explaining to the patients and those that have questions a lot more detail of where you can find information. Does that include sparkling water? No, actually it doesn't, as far as carbonated drinks. You can usually tell if they're carbonated. Some of them I find, as a matter of fact, look on the label if there's anything that might, some form of phosphorus or whatever else that might cause that. There are some drinks that have some form of really light carbonation. But you can do that. Actually, you can actually get these carbonation machines, but use them and actually cause somewhat of a carbonation, but just by using water itself. Anyway, thank you very, very much. Everybody have a wonderful week, and I look forward to seeing everybody next week again with a new subject, new exciting thing that we'll talk about and hopefully help you understand a lot more about your conditions and why you have them and what you can do about them. Again, thank you so very, very much. If you want to check back and see this, we save these all the time, and they go on file on the Fibro Wellness Center. And eventually we're going to see if we can get them on YouTube, so that way it'll be easier for people to track them down. Hey, again, this is Dr. Ken Muich, Fibromyalgia Wellness Center. I always say we're always glad to see your back and other body parts, because with both chronic fatigue and fibromyalgia, it covers the whole body, doesn't it? Anyway, thank you so very, very much for your time. Bye-bye now. Thank you, Shelley.